Dr. Anu Dabar, your rheumatologist and clinical immunologist, practicing at SciAmed The Health Tower, Gurugram. आज हम बात करेंगे about what diet to follow, what lifestyle to lead and what exercises to do in patients suffering from rheumatological disorders or any form of autoinflammatory diseases or inflammatory arthritis. एक important चीज़ जो मैं अपने हर पेशेंट को बताती हूँ और मेरे पेशेंट्स के कॉमन क्वेश्चंस भी होते हैं कि हम क्या खा सकते हैं, क्या नहीं खा सकते, किस तरह की एक्सरसाइज कर सकते हैं, क्या हमें बेड रेस्ट लेना चाहिए। तो इन्हीं कॉमन मिथ्स को डिस्पेल करने के इंटेंशन से आज हम आपसे बात कर रहे हैं। देखिए, इन्फ्लेमेटरी डिजीजेस को कंट्रोल करने के लिए एक कॉन्सेप्ट जिसे हम प्रमोट करते हैं वो है एक एंटी इन्फ्लेमेटरी डाइट। एंटी इन्फ्लेमेटरी डाइट यानी उस तरह का खान पान जो आपके बॉडी में इन्फ्लेमेशन को कम करता है। एंटी इन्फ्लेमेटरी डाइट में सबसे इम्पॉर्टेंट है कि सॉल्ट और शुगर, जो कि ह्यूमन बॉडी के सबसे डेंजरस एनिमीज हैं, इन्हें लिमिट करना चाहिए। सॉल्ट का इनटेक शुड नॉट बी मोर देन 6 ग्राम्स इन अ डे, यानी कि 1 टेबलस्पून, इंक्लूडिंग चाहे आप एंटी हाइपरटेंसिव्स हो या नहीं। सेकेंड इम्पॉर्टेंट थिंग, शुगर। शुगर इज एज बैड एज अल्कोहल एंड टोबैको। इट इज प्रूवन इन रिसर्च दैट शुगर के ज़्यादा कंजम्पशन करने से ना सिर्फ आपको डायबिटीज, हाइपरटेंशन एंड डिजीज का रिस्क बढ़ता है, बल्कि इन्फ्लेमेशन शॉर्ट इंक्रीजेस। So white sugar, brown sugar, any form of sugar is an absolute no for patients suffering from inflammatory arthritis. Third important thing is consumption of tea which contains phytates is also discouraged in patients with inflammatory arthritis because that also is shown to directly promote inflammation. Consumption of even green tea, which does contain these compounds like phytates, is discouraged. Coffee in moderation is still advisable because it's been shown to not really impair or promote inflammation. The third important thing is that we should restrict any form of monosodium glutamate, which is usually seen in noodles and Asian food items like soya sauces, which is known to again promote inflammation. Consumption of fish, egg is allowed, but consumption of meat, especially red meat, which is excessively deep fried or grilled for that matter, with sauces, artificial sauces containing a lot of salts, should again be avoided. Milk and milk products should be encouraged in our diet, and milk products, especially curd, has not shown to promote inflammation in the body. Rather, being a probiotic, it helps to decrease inflammation in the gut, which is a known risk factor for inflammation in the joints and other parts of the body. In fact, limiting milk and milk products can lead to a deficiency of calcium, which can further increase your joint pains, and then it becomes a vicious cycle. Moving on to consumption of green leafy vegetables, different types of legumes, nuts, seeds, such as flax seeds, chia seeds, is extremely encouraged, and it's recommended in patients with inflammatory arthritis in tune with following something known as a Mediterranean diet. Beyond these dietary precautions, what is also being proven in research is that most patients with inflammatory arthritis have a deficiency of vitamin D in the body. Hence, it is recommended that these patients should expose themselves to direct sunlight for at least 30 to 40 minutes a day, with more than 50% of their body surface area exposed to sunlight. If your vitamin D levels are low, get them checked and take adequate supplementation as recommended by your rheumatologist. Also, it has been shown that in addition to deficiency of vitamin D, these patients also sometimes suffer from multiple nutritional deficiencies like folic acid, iron, B12, and those should be managed accordingly because any form of nutritional deficiency in the body will promote inflammation. A recent study done in thousands of patients showed that adequate vitamin D supplementation helped to cut down the risk of inflammatory diseases, and this was shown in the VITAL study. Importantly, moving on from diet, if we talk about exercise, all patients with inflammatory arthritis should be doing 30 to 45 minutes of aerobic activity 5 times a week in accordance with the recommendation laid down by the American Heart Association. Regular, of course, 2 to 3 times a week of muscle strength training, endurance, cardiovascular strength exercises such as yoga should also be encouraged. Pranayam, deep breathing are all known to promote good health and cut down the inflammation in the body, but again, they cannot be a substitute for the treatment. Diet, lifestyle, treatment and exercise are 4 pillars of treatment that we offer to our patient with inflammatory or rheumatic diseases. Exercises, whether it be walking, running, swimming, cycling, are all encouraged, dancing as well. Yes, in some patients like myositis, what exercise has to be done at what stage of disease, is only decided by a rheumatologist and the physical therapist in consultation with each other and the patient. Also, patients who have ankylosing spondylitis, they are recommended to be frequently active, do frequent stretching exercises like Surya Namaskars, and also be actively mobile throughout the day. The same dictum applies to patients with rheumatoid arthritis. So these are some exercise and diet precautions that these patients need to follow. A very important but often neglected aspect of health is mental health of patients with inflammatory diseases who are known to suffer more commonly from disorders like depression, adjustment disorders. So if you feel that because of your disease you are feeling inhibited, you feel sad, discuss your symptoms, take the help of a psychiatrist, let your rheumatologist know what you're feeling so he or she can get you timely care and provide you the necessary help. So we don't need to be fearful of these diseases. These diseases will live with us for long, but we can let them be a friend and not a foe. So follow these things, meet us, consult your rheumatologist. Don't let these diseases be a hindrance to your dreams, your ambitions, or whatever that is that you want to do in life. Thank you.